We found ourselves without healthcare insurance. We were going under financially. I just made up in my mind that I would not, go back to the emergency room to run up more bills that I couldn't pay. I had got lost on the expressway, and I came around 115th Street, and I saw Chicago Family Health Center. The doctor, she sat there and she talked to me and she listened to everything that was going on, and then actually took notes and wrote down a plan for my health and asked me what I was concerned with. And I told her about the medication, I can't afford it. And she said, well, we have a pharmacy, in-house, and some of the things that you need, I can give you some samples of some sinus medicine and so forth. And I literally cried.
Healthcare is something that people shouldn't have to do without. And if you look at the healthcare system in America today, the people who most need it, who are most underserved, are right here in Chicago. We don't have to go abroad to find them.
Chicago Family Health Center serves Chicago South and Southeast Side, providing primary preventive health care services to over 24,000 people who wouldn't have an opportunity to get health care otherwise.
At Chicago Family Health Center, we take a great deal of pride in being a comprehensive health provider. In other words, whatever the needs are, whether it be perinatal, prenatal, whether it be hypertension, preventative care, whatever that need is, Chicago Family Health Center wants to be able to provide it. So our customers, our patients only have to make one-stop shopping.
At Chicago Family, we take care of everybody. And when we say everybody, we really mean everybody. We have a sliding scale program that reduces per visit fees to as low as $10 for medical care for people who really need it.
Well, I don't have insurance because it's too expensive for me. With my job, they are willing to pay up to 50%, and if they did that, I would have to pay almost $200 a pay period, and I can't afford it.
We see mothers with children. We see working people. We see people who have to take time off to come here and provide health care for their children.
Pues le sacaron sangre para hacerle el físico para la escuela. Pues que atienden bien y atienden con respeto a la gente, las personas que están.
A lot of times patients do have health care questions, and they can't just go to a hospital every single time. They feel like they have something wrong with them, and hospitals are swamped right now, and they don't really take the time to explain to the patients, like, this is, the proper treatment for what you have. These are the things that you can do at home. So if we take the time to explain to them how to take care of themselves better, how to take care of their children better, then that prevents future, treatment.
For the first time, somebody wrote my name on a patient chart, and I was able to see my doctor, not just someone in the emergency room that I have to tell all over again what was going on with me. I left the clinic and I was in tears. It took a half an hour just to pull off the parking lot, because the very thing that some people take so for granted, when you don't have it, you realize how important it was.
I think we have the best team in community health in Chicago. Our over 230 coworkers are excited about coming to their jobs every day and are passionate about delivering the mission that Chicago Family delivers to our patients.
We're like family, and we have a lot of dedicated patients that have been around a long period of time.
I think that every patient that I see has their own unique and compelling story. And when I see them for the first time, and this just happened today, they are taken aback at the level of services that we'll provide even just on that first visit. It's heartwarming every time I see a patient, and when they say thank you at the end, whether it's in Spanish or in English, it's so heartfelt, and you can tell it's real.
We're going to continue to keep expanding and providing quality health care to our patients, and we're glad to do it.
Our newest project is a new full-service health center facility in the Chicago Lawn neighborhood at 63rd and Kedzie, which takes Chicago Family's reach westward and northward of where we've operated before. And we're very excited to be delivering a service in that community that desperately needs it.
Chicago Family stands in the gap. It it's not, to me, just a clinic. It was a life raft that someone threw to me when my boat was sinking.